It all started with one patient. They had come back to the hospital in a worse condition because they misunderstood a simple instruction. And that moment broke me. But at the same time, it also birthed something in me. I realized the problem wasn't just access to doctors. It was access to understandable health information. And so I took to social media, not just as a medical expert in a lab coat, but as a friend who could break it down in simpler English and pidgin with humor and with context. And that's how Aproko Doctor was born. From one tweet to one video, we've built a community of over 10 million people and growing. But beyond the numbers are the platforms. There's where we celebrate healthy living and remind ourselves that health isn't just something we treat, it is something we live. Through our non-profit, the 100K Club, we've raised millions of naira for medical bills, screened thousands of women for cervical cancer, and even powered hospitals with solar energy. From Nigeria to social media timelines, the mission is the same: to make healthcare accessible, relatable, and human. Well, this journey has taught me that people don't just want doctors. They want understanding, truth, and hope. So when you ask how we went from hashtags to healing, it wasn't magic. It was community. It was you.
Well done, Aproko Doctor. What inspired the name?
It was more of a need to ensure that healthcare was something that people wanted to gravitate to, because this was at the time when social media was becoming a thing. As at the time when we started Aproko Doctor, it wasn't Aproko Doctor first. It was, it was something else. I really can't remember. And so I started that conversation and I was prescribing, don't do this, don't do that.
Saying
this is, this is, and nobody paid attention, to be honest. When you post something, just like you mentioned, you were saying 2 likes. One of those likes was mine. I want to like it. And then come back, unlike it and like it again, just so that, it's able to get as much traction as possible. But then, rather than complain that, the people around me don't like me, I had to go back and look. What was my goal? My goal was to reach more people. Which kind of people? The people who necessarily did not have access to this information. And what were they watching? They were watching the funny guys, they were watching the guys which is love stories and all that. And that was how we tweaked it and tweaked it and tweaked it. And I realized that when you say doctor, people expect you in a lab coat, stethoscope around your neck, well manicured English, But that was our perception until we changed it and we just started telling stories. And it stuck. We were like, okay, what do I call myself? It was between Aproko Doctor and Aproko Doctor. Okay. And recently I got to find out that Aproko Doctor was actually a lady's name.
Oh.
Yes. She was in one very popular show, sitcom that aired, in the early days, and her name was Amebo. And so people just added the name Amebo to mean somebody who talks
a lot.
But her name was Amebo.
Oh.
So I'm really grateful I didn't go for Amebo.
Interesting.
We decided to go for Aproko Doctor because it was eye-catching. It was something that would drag your attention, basically.
I like the way you pass on your message. It is very simple and straightforward, and it connects with the audience you're targeting. A large part of healthcare is preventive care.
Yeah.
We cannot maximize preventive care without effective communication. And the core of effective communication is understanding, which you have had. Well done, Aproko Doctor.
Thank you. Thank you.
Okay, for me, I will share one of the encounters I had with your content. So this friend of mine sent me something about tomatoes that you did. When you have tomatoes with the white growth on it, and say, I've told you, always managing things. See, Aproko Doctor has said what I've been telling you all the while. And that's just one. I remember again that somebody on social media said, well, since Aproko Doctor said this, my husband and I have been quarreling about why, the rightness and the wrongness of it.
So you're causing marital problems.
So you see the drink water part.
So you see, your content is engaging. It is about life. As you said, it's about storytelling will always get the attention of people much more than data, statistics, and all of that. So I'm just going to tell you, well done on all that you do. I follow you a lot. in part strategically. I like that you started the year with the challenge and really caught on very well. Yesterday, I read someone on social media who's talking about liver detoxification. And I said to myself, oh, not many people know this. She was sharing her personal story on why she had to go that lane. And I said, you see, this is the thing about preventive health, which we don't have a lot of here. Imagine if we have an Aproko doctor, like 8, 10, 100 of them speaking these things into our consciousness, how better informed we will be. We'll probably spend more time doing more preventive health than buying ashwebi as women. You know.
That's fired. That's fired.
And if you see a lot of our media stations, I said to myself, and people will tell me, okay, when are you going to have your own media station? And like, if I'm going to have, it's going to be on health. Okay. Because there's a lot of misinformation out there. There's a lot of people doing the same thing out there. Yeah. This station is general format, that one is general format. We need, just like traffic radio. Yeah. So we need a radio station, a TV station, you know, focusing on health.
I love that, by the way.
Yeah. So that's the way I feel about your content, and I think you should grow into that.
I'm really impressed by that idea, and I hope it comes to life. You just want to be sure that the people who are going to buy that idea see beyond the initial profit margins.
Yeah. Right.
Because healthcare is something that pays you in the future.
It's not fancy.
This 2025, it's been 10 years of us repeating the same message over and over again. It started in 2015. And so the same year, over and over and over and over, and kept hammering it until it stuck. You know, and even now, we've realized that, there is another massive group that you're yet to reach out to. But the problem is you cannot build an entire industry on one person. Right. You have to create an avenue for other people to, take on the message. And that's also why we started the Aproko Doctor Academy, where we're now training health professionals to be able to communicate better. It's not just about, people are not impressed by the information in your head.
No,
nobody
it's the storytelling.
Cares. Yes, it's the storytelling. So you're training the professionals to become storytellers. And of course, not everybody can do it.
Amazing.
I grew up in a generation, and I'm very grateful that I experienced that generation. I grew up in a generation that we grew up to content online that could educate, content on TV, rather, that could educate us. You watched a TV station, and you left and you had information in your head, but it didn't come in the form of information, it came in the form of a story. Right now, you have kids who have access to their parents' phones and they're exposed to adult education. So we needed to bridge that gap, and for us, it was with healthcare. So we're still battling with the skit makers, the content creators for attention, the people who just want to go viral, the bloggers who just wake up, cook up one story, share it online, get
and people
trends,
run there.
Likes. And it takes partnership to be able to do this thing. But the people you're going to partner with have to have that same mindset that, look, we're looking just beyond the initial gains. For example, if you look at NCDs, NCDs are non-communicable diseases, hypertension, diabetes, metabolic diseases, and they're really wreaking havoc, especially on the older generation. Sometimes even on the younger ones. You have younger people who are in their 30s with hypertension, and a lot of these things can be prevented.
Now you are geeking out.
So, so I like the work that you, of course, and I've also seen other doctors that have taken social media to do what is happening, and that ecosystem, you guys are just amazing. What you're doing is breaking down healthcare, right? And we are eternally grateful for that. But I want to speak on, you said something about health is for living. That's very important. Yeah. It's it's what you do from here, not what happens when you get into the hospital, right? Mm-hmm. I also like what you're doing with AwaDoc. It's important to me because you said you're using Nigerian doctors and AI, right? I'm also curious as to how that data gathering is happening. Right? So I'm hoping that with the work you're doing, and maybe there are other people doing the same thing as well, we hope so, that are able to train this AI with things that are peculiar to us when it comes to healthcare. Yes, health is health, but at the same time, there are issues that are peculiar to our climate, our people, from the kind of food we eat, the kind of weather we interact with and all that. So hopefully, when we then interact with this AI that you're building, it is very localized, and I can understand that, yes, this AI knows that I ate a and it will do.
Exactly.
Do you understand what I mean?
Yeah.
And this is what can come. So yeah, kudos to you on that, and well done on
I
that.
would like to ask, is our doc looking for investors?
Yes, please.
Yeah,
Okay,
so
fantastic. We'll be talking.
for me, I will approach your advocacy very differently. First, I want to say well done. For me, I see a young Nigerian who has refused to allow the system overwhelm him, rather to give back to the system. I mean, you reeled out all the things you've done using this platform, and the truth is that you cannot give back to your society and remain stagnant. You are going to grow, okay, just the way you've grown. And I think it's a lesson for our colleagues who are always thinking that the way out is to japa. Okay, the average health worker now wants to leave, but I hope that to the medical community, they see that barriers can be broken, and to the youth in general to see that we can use our talents, you know, to give back to the country we all say we love. Now you can comfortably criticize, so to speak, because you've added value to this country.
Yeah.
You get, it's not just to always sit down. And I have some friends who have jackpot. I have nothing against jackpot, but when I hear them speak, I wonder what they are like. Zero patriotism to the country. I had to tell one of them, but Nigeria made you a doctor. Forget wherever you are now, whether you are in Canada or you are in Nigeria.
And it's cheaper to be a doctor in
Nigeria
Nigeria
made you
than
a doctor.
elsewhere.
And so, well done. That's just that's how I want to approach this, and it should be a lesson and an example to the rest of us.